Good morning, everyone. Good morning. Oh, I was going to start this earlier, but I had to edit some videos early in the morning. But I wanted to show you a glimpse inside of what I do for my home care. So I'm going to show you my warm-up. I'm going to get into traction, and then I'll stop the video. But let me just explain. So our patients, let me flip this over here. Our patients have home care prescribed to them based on what's going on with their spine. We have three main sequences for a warm-up, and sequence 1 is mostly neck, sequence 2 is thoracic, and sequence 3 is lumbar. So depending on where their primary issue is, from a standpoint of pain and discomfort, from stiffness, from dysfunction, from the need for spine remodeling as far as home traction, we then prescribe what the patients do based on what their issue is. So we don't have a one-size-fits-all approach, or one just does the same generic thing. So what I'm doing is I'm primarily doing cervical. So I'm gonna warm up my thoracic spine, cervical spine. I've already been up for, what time is it? 7:14? Yeah, I've been up for about 3 hours. So I've been up for 3 hours, getting some work done. I'm recovering from a little bit of a tricep tendon issue, so I'm actually not weight training for a couple weeks. So I'm gonna go through foam rolling just really briefly, because we're just trying to desensitize tissue, and then double the cross ball. So I'm gonna work on that next. And then I'm gonna use neck trigger point tool. Then I'm gonna get into traction. All right, so my traction set up, and this mounts over a door, but I mounted it over my Rogue rack over here. You can see that bar up above, the pull-up bar, and then the strap coming down, and it goes to a movable neck traction unit for cervical spine extension. Good morning, Brandy Hunter. Brandy's our office manager, and she just posted up pictures of her doing her home care too, because her and I were messaging this morning about some projects we're working on, and I said, sequence 2 plus thoracic traction, go. And she went and did it. Good job, Brandy. All right, so anyway, I'm working with a double cross ball right now. And again, this is just to desensitize tissue. So this is the first thing we do before we do any sort of tissue extensibility, like stretching, is you want to desensitize tissue globally with a foam roller, more specifically with something like neck trigger point tool, double cross ball, J-cane. And this is all inside of our home mobility kit that all of our patients get and use. And I'm doing somewhat of a summarized version because I'm doing this live for all of you. And the next thing, let me set this up right here. My handy dandy stand. Got my neck trigger point tool. Got the hood on, looking like Grim Reaper. All right, so this is, again, it's not to change length of tissue necessarily, but it is to break up the fuzz. And if you never watched that before, there's a really cool YouTube video. If you type in the fuzz, there's a guy doing a cadaver dissection, and he talks about the fact that every night when you go to sleep and you wake up in the morning, you have this almost glue-like material that goes between the fascial layers, and it creates just less gliding and sliding between tissues. And if you don't go through ranges of motion, if you don't go through movement on a daily basis, that fuzz starts to turn into more and more rigidity. You have less movement. And then it causes this whole feedback mechanism where then over time you just can't move, right? And then there's a whole process of trying to regain movement again, which is what we're all about with our patients, is moving well, segment, posture, movement for overall health. So I'm using this neck trigger point tool because I got some areas in my neck that are pretty tight, because for the last several days, I'm going on a rampage of doing as much cervical extension traction as I can in the next 30 days, and I'm gonna re-x-ray my neck, because I just took some new x-rays of my spine last week, and I had some things in my neck that regressed, so I was dropping the ball. So I gotta practice what I preach, so I'm upping my game here. All right, so I just went through, did a foam roller, double cross ball, neck trigger point tool. Now I'm gonna do a modified version of a 6-way neck stretch. I'm just trying to breathe and relax. So I'm pulling my head obliquely down, like towards my right pocket. All right, and depending if the nose is turned towards the pocket or away from the pocket, we'll hit more upper trap versus levator scapula. the opposite arm, so this arm, I'm going to depress and pull down to try to put more stretch on the levator scapula. All right. Okay. Oh, also too, for everyone, I took these, I'm not sure if everyone knows that we have this, but we have these guided traction videos. They're kind of like guided meditation, and you can listen to the soothing voice of me, Dr. Todd, right? How cool is that? Going through and coaching you through your traction. We put this together so patients can use it. And just grabbing a neck exerciser. So anyway, what it is we made these videos that are pre-done that are between, I think, 5 minutes, 12 minutes, and 20 minutes. And then how that works is you just hit play, and it has a count up timer, and it coaches you through the process of traction. Gives you cues every minute, tells you you've hit 1 minute, 2 minutes, 3 minutes, tells you how much time you have remaining. It's kind of a cool, just motivational thing, and it plays nice, soothing music. Trainer Tony helped me make those a couple years ago. So I took those videos, which were somewhat hidden, like people didn't know about them, and I added them to movewellrehab.com. So you go to movewellrehab.com and you click on the bottom left box, which goes to the neck traction unit. You'll see advanced traction videos, and I just uploaded 4 of those this morning, so you'll have that in there. The guided meditation videos. That's what I'm actually going to listen to as I do my own traction. I know it's kind of weird. I'm listening to my own voice while I'm doing traction. I don't know if that's, I don't know what you call that. But anyway, Brandy, sorry. But I listened to the soothing voice of Russell Brunson instead this morning. That's funny. Russell Brunson's great, but he doesn't have a very soothing voice. Russell Brunson from ClickFunnels, which is good. I listen to his podcast all the time as well, which is Marketing Secrets. So there's a free plug for Russell, like he really needs it, but he's got it from little old me and Brandy. Okay, so that's gonna be my modified warm-up, because Brandy's probably looking at me going, you need to get changed and get over to the clinic. We got patients pretty soon. I know, Brandy, I had to finish these videos this morning. You know how I roll. Okay, so I put a mat down like this, and let's see if I can do this while I'm on Facebook Live. You're not gonna see me hang myself live on Facebook. Let me put this down for a second. Okay, so this is a mid placement for me. All right. Okay, then what I'm gonna do, this is hard to do with one hand. What I'm gonna do is I'm gonna push up here, which unloads it. And then once I unload it with my other hand, I'm gonna pull on this strap right here. Okay? Because that's the easiest way to get in here. I'm gonna put this down for a second so you can. All right. Alrighty, so here we go. So now I'm in it, all right? So the neck traction unit, I'm at about C5, C6 placement. That's where I need it. And I'm gonna totally relax. I'm actually gonna end this video so I can start timing this. The goal is to hit 20 minutes. I'm not gonna have 20 minutes this morning, so I'm gonna do 15. And I can already tell you, I mean, if you've never done this before and you have any sort of neck discomfort, going into forced extension, as long as there's no contraindications, which it's rare to have a contraindication, but we can determine that off a flexion extension video. We have some training that we did inside of our neck traction unit doctor training where I talk about this stuff. But going in a forced extension like this, when you have a cervical spine issue, is literally the only thing I've ever found that feels like it scratches the itch that nothing else can do. So forced extension, it's challenging. It's not supposed to be a feel-good therapy. It's challenging, but it is relieving because you can tell, oh my gosh, it's putting my spine into the healthiest position possible. So this is what you, as your staff, you as the doctor, everyone in your clinic should be doing this stuff, and this is what your patients should be doing. If your patients are actually wanting to go through a corrective process and not just get palliative pain relief care, if they have a loss of cervical curve or a cervical kyphosis, you gotta do something like this with them, or that process is going to continue. This is going to help actually correct the cause of the problem and get them strong and healthy for a lifetime. This is spine rehab. This is spine hygiene. This is like brushing your teeth every day. You should be doing neck traction every day. So anyway, with that said, I'm gonna close this out. Let me know if you have any questions. We can do a little comment thing below or whatnot, but I'm gonna start timing this. I'm gonna count this as 3 minutes. I got 12 to go. Over and out. See ya.